Special thanks to the Kay Family Foundation, lead underwriters for Mosaic. Hello, my name is Barbara Kay, and on behalf of the Jewish Federation of Palm Beach County, I'd like to welcome you to our program, Mosaic. Our very special guest on Mosaic today is the JDC Medical Director in Ethiopia, Dr. Rick Hodes. We'll be back with our guest and our program right after this brief message.
The Jewish Federation of Palm Beach County makes so much possible every day.
Serving tens of thousands of kosher meals to seniors and families through food pantries, the Jewish Hunger Response, holiday meals, and on-site meal programs.
Operating the Jewish Community Assistance Network in 6 local communities to provide health, wellness, and social programs to more than 2,000 seniors.
But we need your help. Volunteer your time. Pledge your support. Make a difference. Thank you for your generous support.
Another year you made a promise, another chance to turn it all around. And do not save this for tomorrow. Embrace the past and you can live for now. And I will give the world to you.
Welcome back to Mosaic, Dr. Hodes. It's such a pleasure to have you here.
My pleasure to be here. Thank you.
You have a story that's unbelievable. So we're going to start at the beginning, assuming that our viewing audience doesn't have any background on you. What brought you to Ethiopia initially?
You know, I finished my internal medicine training in Baltimore in 1985, and I wanted to teach in Africa for 1 year. And so I first got a Fulbright fellowship, and I went to Ethiopia to teach at the medical school. And I did that for 2.5 years. I left. I came back in 1990 to work with my present employer, the American Jewish Joint Distribution, to be in charge of the health of all the Ethiopian immigrants to Israel.
Yeah, that's called Operation Solomon. I think it was November 15th, 1990. You were in the middle of this whole, was it chaotic or helping humanitarian effort that was extraordinary. Explain what that was.
Well, 14,400 people ended up being evacuated to Israel over about 30 hours. And so the community was identified and they were notified. And my job that day was getting people out of the hospital. So I had to go across the city to various hospitals and get people out. I had a kid in the leprosy hospital whose name was Mandefro. Mandefro had both tuberculosis and leprosy and was very malnourished. I ended up picking him up and running with him to my car. and getting him out of the hospital that way. And then he later was flown to Israel, and later on that day, and reunited sometime later with his grandmother.
It's an extraordinary story. Let's go back a little bit.
Okay.
The American Jewish Joint Distribution Committee was involved with this group of Ethiopians who were Jews,
Yes.
the Jews of Ethiopia. And they gave them an opportunity. I think it was Lubrani was the emissary from Israel that paid to allow the Jews to leave Ethiopia and go to Israel. Am I correct?
Yeah, Mr. Lubrani, Ambassador Lubrani was the person in charge of the negotiations from the Israeli end.
Yeah, because they didn't want to let them free. In other words, the Jewish Ethiopians, what were they called?
They call them, well, Beta Israel, or sometimes they use the word falasha.
Yeah, but they are observant Jews.
Yeah, they are.
And it was very, very difficult time for them in Ethiopia. They were persecuted, and they were discriminated against. And 14,000 of them went in that limited period of time, but there were a lot more left, Rick.
Yeah, 39 flights flew in that day, and they were loaded up with people, and they took off. So, for example, the 747 took off with 1,079 people.
Yeah.
When it landed in Israel 4 hours later, it had 1,080 people because a baby was born on the plane.
Yeah, that was amazing. Were you prepared for this kind of an experience? I mean, how did you prepare yourself for this number of people that are involved, the clinic that you work in? Describe the environment that you actually literally work in there.
Well, JDC had started a clinic. We had 5 doctors at the time. Each doctor had an assistant for education purposes. And, they were seeing patients all day long. And so we would have, we had 25,000 people to start. So we had a lot of people that we were seeing on a daily basis. A lot of different programs for them, health education and immunization, family planning. So all of this was going on in the setting of a civil war. So the rebel armies were getting closer and closer. The dictatorial government of Mengistu Haile Mariam, the leader of the country, was about to be overthrown, and he sort of knew it. So that at the towards the end of May of 1991, he got on the plane and he flew off to Zimbabwe, where he lives to this day. And then eventually, an interim government took over for 5 or 6 days, and they're the ones who gave the agreement, the green light for Operation Solomon. And then they were overthrown by the present government, which has since been reelected, and that's the government of Meles Zenawi.
But there were a lot of Ethiopian Jews that never got on the planes, and they were still in Addis Ababa. Am I correct?
Yeah, well, there's another group of some people did miss the plane, and then there's another group of people who claim to be the descendants of Ethiopian Jews who converted to Christianity under duress. And they're known as the Falash Mora. And that's largely the group that we've been dealing with since 1991.
You work in a clinic of Mother Teresa's, don't you?
I do. I work in this Catholic mission where I take care
Sister
of...
Teresa, I should say.
It's
mother and sister.
Yeah.
Yeah.
It's a Catholic mission run by the nuns, and we take care of sick destitutes. I myself work in 3 different areas, in heart disease, spine disease, and cancer. Heart disease, for me, it's rheumatic heart disease and congenital heart disease. Spine disease for me is TB of the spine, which causes a big V.
Yeah, the V.
And
We have
scoliosis, which causes an S.
Wow.
And then I treat kids for cancer.
Can you really, do you really, correct some of these terrible deformities? There are 5 million orphans in Ethiopia. You have tens of thousands of them in the streets. How do you hope to deal with this?
Well, I can't solve all the problems, but I can help a few kids along the way. So kids with bad backs come to me, and I evaluate them. I'm in partnership with a doctor named Dr. Oheneba Boachi Aje. People call him Dr. Boachi, who's originally from Ghana. He moved to America when he was 18 years old, worked his way through Brooklyn College, Columbia Medical School, spine training in Minnesota, wonderful guy. And he has a hospital in Ghana. He lives in New York, but he goes back to Ghana. So I send my patients several times a year to Ghana for surgery. Yeah. Last year I had 50 kids operated on in Ghana.
Really?
Spine surgery in America costs about $200,000. Spine surgery in Ghana cost me $18,000, including the airfare.
You're kidding?
Yeah.
Wow. You also are very involved with some of your patients to the point where you invite them to live with you in your home.
Yeah, even the first couple of spine patients that I got, I wasn't able to get them surgery, so I ended up adopting them and adding them to my health insurance and getting them surgery that way. And now they're my kids. I mean,
yeah. Oh, how many of them? You have 15?
Five.
Oh,
well,
5? You had 15 at one time.
Well, I give housing to some others, but these kids are now living largely in the States for education purposes. I just spent the weekend with one of them who's now applying to college. He was, when I first met him, he was an abandoned orphan living in a room at the Catholic Mission for sick, unadoptable kids. And now he speaks perfect English, and he wants to be an electrical engineer, and he's applying to college.
Wow. I understand Shabbat at your house is really a neat experience.
Oh, we love Shabbat. Everybody loves Shabbat. Jews, non-Jews.
Explain about it.
So we stand in a circle, we hold hands. We start off by singing If I Had a Hammer, the Pete Seeger song. And then afterwards, we go around, we introduce ourselves, say who we are, where we're from, what we're doing in Ethiopia. And then we go on from there. So then we sing Shalom Aleichem, the typical song, welcoming the Sabbath. And then we'll have soup, and we'll do Kiddush. People will get to know each other. It's great fun. I mean, and the kids, it's great for the kids because they meet so many interesting people who are passing through Ethiopia. They meet visiting doctors, they meet visiting diplomats. It's a wonderful experience for them.
Yeah, I would imagine. Reading Marilyn Berg's book, which was really a tremendous covering of everything that you do. I mean, she really did a terrific job here, I think.
Yeah, she's a very experienced woman.
She says something in there that you're like a junkie with these people. You get such a high from what you do.
I do. Like, for me, the greatest thing in the world is putting a kid on the plane to go off to Ghana for spine surgery. And then when you meet him at the airport, it's like winning the lottery. It's just like, wow, look at this kid who was so crippled before, and how they're still in a bit of pain when they come back, but they can walk straight.
Can you actually straighten them?
Yeah. I have one kid whose name is Binyam. He's the son of a taxi driver. He started off below my shoulder, ended up above my shoulder. He gained like 5 or 6 inches during the surgery. This is quite common.
Yeah. You know what's so terrible? When you have to play triage, this is a large part of your experience from what I've read. It's
a tough situation. I actually, fortunately, I'm an internal medicine doctor, so I don't have to do the choosing myself. All the patients who come to me, I evaluate, I do their x-rays, I do their photographs in a certain standard way. And then I send all the information to Dr. Boachi in New York on CDs, and he's the one who does the choosing.
It's absolutely incredible. The American Jewish Joint Distribution Committee is a remarkable organization. I mean, they really are. They do such great work in about 160 countries around the world. Part of the money that the Federation raises on its annual campaign, a portion of that goes to its overseas partners, and JDC is one of their partners. They're very actively involved with you financially, aren't they?
Well, I mean, everything that I do is a JDC project. So what started out, for example, working at the Catholic Mission as my personal volunteer work is now an official JDC project, and people can donate to us through JDC.
You're a religious man.
I am.
Yeah. Is that where you go for your comfort? I mean, how do you give yourself peace or your soul?
Well, I try to exercise every day. I try to do something a bit different every day. But I also pray 3 times a day. And I somehow like to think that the Almighty is helping me.
Well, I'm sure He's looking over both of your shoulders, if not one.
and sometimes things happen that are just amazing.
Like?
I had a woman whose eye was popping out of her head because she had a brain tumor the size of an orange. And I was in Minneapolis. I couldn't get anyone to operate on her. I was in Minneapolis. I went to synagogue one morning. And in synagogue, I started speaking to the guy next to me. And it turns out that he's a brain surgeon who operates only on the bottom of the brain. It's called a skull-based neurosurgeon. And so I showed him these images, and he said, "Oh, I'd love to help her." So this chance meeting in the synagogue saved the life of this Muslim woman. So if I hadn't gone to synagogue that day, this woman probably would have died.
Yeah.
Is that amazing?
It is.
And so you have a Muslim orphan raised by Catholic nuns, treated by Jewish doctors, being operated on for free in a Catholic hospital in Minneapolis. It's all of us working together. It's wonderful.
Do you know something? We live in such a world of turmoil. People mistrust people. People that are different don't shy away from each other. This is a perfect, embracing concept.
Yeah.
Why can't you sell it?
I'd love to. I'd love to just give it away. I'm not trying to make money, but
No, I'm serious.
I think it's a great idea.
Yeah.
I think it's a great idea. It's an example of how we can all work together.
For sure, without question.
And sometimes if we concentrate on a different goal instead of just our differences, we can make a lot of progress that way.
Well, you certainly have made an example. We'll be back with the remainder of our program right after this brief message.
Another year you made a promise, another chance to turn it all around. And do not save this for tomorrow. Embrace the past and you can live for now. And I will give the world to you. This is a new year, a new beginning. You made a promise, you are the brightest. We are the voices. This is a new year. We are the voices. This is a new year.
Welcome back to Mosaic. Prior to the break, we were talking about some of the remarkable things that Dr. Hodes has done, but I have to ask him, I must ask him if you don't mind, about your hat. I think it's charming. Is it a yarmulke?
Yeah, maybe it'll double as a yarmulke. But when my patients find out that I'm going off to America, they often will hand me a hat and they'll say, "Wear this in America." So
Oh, really?
I started wearing the hats that they make in the United
Oh,
States.
wow. Let me see the
Yeah,
back
so-
of it. Oh, yeah. It is a handmade.
Yeah,
Oh, my
it's a
goodness.
hand-knit hat by a handicapped young man at Catholic Mission in Ethiopia.
That's marvelous. Actually, do you ever go to Israel to visit some of the Ethiopians that have made the journey?
I go to Israel at least once a year, and I run into these people all over the place. So Israel's 1.5% Ethiopian, and so I frequently run into them. And the other thing is, my Amharic is better than my Hebrew, so if I need to ask directions, I'll find an Ethiopian and ask
him in Amharic. That's terrific.
So,
What I was going to ask you something about their experience in Israel in terms of their adjustment. I remember when I was there and I went to a graduation of high school teachers, Ethiopian high school teachers, there was one young man that looked as though he were the leader of the group. So I went over to him to congratulate him on getting this wonderful opportunity. And I said, "What was the first thing that you thought of when you landed in Israel?" He said, "I had no idea there were so many white Jews. I mean, they were so isolated and lived such limited, enclosed lives that they had no idea what other people looked like or or
it's
anything
true.
about the
It's
21st
true.
century or anything."
I mean, just last week I was in a village in Ethiopia where there never had been a white person, and so a lot of the young kids had never ever seen a white kid.
Yeah.
And so when I stepped into a nearby school, like the kids just ran out of the school because there were 4 white people to take a look at.
Yes. At any rate, there was another chapter in the book where she describes what happened when you went to Goma. Explain about why you were there, what was taking place, and what you saw.
Well, there was a terrible genocide in Rwanda after the plane carrying the president of Rwanda and Burundi was shot down. And so this started a civil war, and eventually hundreds of thousands of Rwandans fled from Rwanda into Zaire. And so I went to Goma, Zaire, the summer of 1994 to help out. The 27th of July, 1994, 7,000 dead bodies were picked up on that day.
God.
So I arrived just a few days later. And we went into the refugee camp. I hired 4 Ethiopian doctors and nurses. So there was the 5 of us. And we flew from Ethiopia to Entebbe and then on to Goma Zaire. The Israelis beat us to it, so the Israelis were there. They started a field hospital. So we spent our first night sleeping outside the field hospital. The next day we went to work. So there was hundreds of thousands of people in this refugee camp that I later would be the medical director for 25% of. So I was the director of at least 50,000 lives there. And so we would go to work every day in the middle of a cholera epidemic. Now, cholera is a massive watery diarrhea. And I would examine the people, I would feel their pulse, I would feel their belly to see how dehydrated they were, and then decide if they need treatment, if they needed IV, or sometimes I would give treatment into the belly called intraperitoneal hydration. And sometimes we would start working in the morning, we would walk, by the end of the day we'd be 100 feet from where we started. But during that period of time, we would have each saved 15 or 20 lives.
You said.
So I actually sent a message to JDC saying, because the 5 of us came here, in a week or two, there's going to be at least 500 Rwandans who are alive because of our work here.
Wow. I remember you were quoted in the book was saying that it was so horrific, you can't even describe what you saw.
There were so many dead bodies. I mean, there were dead bodies just lying there, and there was a truck that would go across the camp once or twice a day just to look for dead bodies and pick them up.
Oh my God!
It was a terrible situation.
What's the situation?
And then they would be buried in a very the refugees were all Catholic. They would be buried by the Catholic Church in a very respectful way.
What is the situation that exists now in Addis Ababa with the Ethiopians that are still are not transported to Israel, still waiting?
Well, there's several thousand Ethiopians who are somehow still waiting, and they are now in Gondar in northwest Ethiopia, and they're going to Israel at somewhere between 100 and 200 people a month.
A month, yeah.
They're in good. They're
in good shape.
They're quite healthy. The death rate is quite low. They're getting nutritional support, so they're not in bad shape.
I read somewhere that 2014 they're going to cut off any more transportation from Addis Ababa to Israel.
Don't know.
Well, you don't know anything about that.
They haven't told me.
I haven't told you. Tell me, it's very costly what you do. I mean, it's got to be. How do you get all the funds that you need for medical help? And does JDC supply everything?
JDC helps me fundraise, for sure, because all of these are JDC projects. So we're digging schools, we're digging wells, building schools, giving scholarships to girls, and then my medical work at the Catholic Mission. All of these are official JDC projects, and people can donate either through JDC or I have my own website, rickhodes.org, and that links to the JDC website for donation purposes. So they get a tax receipt from JDC, and then the money can go to whatever they're interested in.
Now tell me,
I've sent about 50 patients to Ghana last year for spine surgery. One spine surgery in America is $200,000. One spine surgery in Ghana, including airfare, is $18,000.
Let me ask you something, Rick. Why are the Jewish people so engaged in this area of the world?
I think Jews have a good heart when it comes to the suffering of other people. We've had, throughout our history, a certain degree of suffering, for sure. And when we see people in difficult circumstances, whoever they are, I would hope that our hearts would go out to them and we would try to help them.
Yeah. You came to the United States 2.5 weeks ago. I know you're going back to Ethiopia tomorrow.
Yeah, but I came with a 12-year-old boy who has recurrent Hodgkin's lymphoma. I found a doctor in Detroit to give him free radiation therapy, and so he's going up to Detroit. He's actually in Detroit right now getting radiation therapy every day.
Yeah, but while you're here, you've been speaking to groups of people.
Sure.
Are a lot of people surprised at what you have to say in regard to,
They are surprised. They are surprised. They're surprised that somebody would do this and do this for such a long period of time.
Yeah, why?
It's not our culture to just
No, I don't mean that. I mean, why do you do this?
Why do I do this? I just like to help people.
Yeah. And you adopted your 5 of your children?
Yeah.
And what do? You hope to see them grow up, get married?
I hope so.
Yeah.
I hope so. Right now, I mean, they're mostly abandoned orphans who would have died. And one of them is now a junior in college majoring in chemistry. One is now a sophomore in college. He's writing a book about the two halves of his life. I just spent 5 days with one of the kids who wants to be an electrical engineer. So
Yeah.
there's so much potential. Ethiopians are so bright, and if you help them get an education, they can do so much.
You know, it's a miracle when you think about it. When during that Operation Solomon, the people, the 14,000, et cetera, and the new baby, in a few hours, went from a very limited environment to the 21st century or the 20th century. How did they adjust? It's amazing.
It's a terrible challenge.
Challenge, yeah.
I mean, if you're used to, if you can't read and you can't write and you're living in a village and you end up living in an apartment in Netanya or an absorption center outside Jerusalem, life is going to be very different for a while before you get used to it. And the challenge is, it's a tremendous challenge to absorb them and to make sure their kids do well.
Yeah, you know, it's Israel was at for a while very finding a very difficult time trying to assimilate them and help them adjust. It's a lot.
It is.
Of
it's
effort.
A huge
it's a
challenge.
very big
it's
challenge.
A huge challenge.
Yeah.
And Israel's now 1.5% Ethiopian, so you see Ethiopians everywhere.
Yeah. Do you have any comments on this book? I love it. Because when she says here, this is a soul, that's how you see these people.
Yeah, you know, what happened was she was in the room and I was taking pictures of the patients. I take, for the spine patients, about 20 or 25 pictures in different positions. And I always start out, each of my digital medical records, I start off just with a face picture. And somebody was in the room and said, Rick, it's a spine problem. Why don't you just take a picture of the back? And I said, well, the patient has a bad back, but this is not just a spine. This is a soul. And so she used that as the cover.
Yeah, that was so beautiful. I remember she quoted you in that. Also, she fell in love with a little fellow there, and you fixed him up, and she adopted him.
Yeah, that's an amazing story.
Have you ever visited with her?
I saw her last week.
Oh, you did. And how's her son?
Everything's fine.
Everything's good. He came into her life at a very good time, too.
Yeah.
She
John
lost
had
her
just
husband.
died.
Yeah. So you see, you never know. Well, what have you got to say to the people that are watching now?
I would say that it's a big world out there, that we should all try to become better people. And no matter what we're doing, whether it's something minor or something major, try to make the world a better place.
Yeah.
If they're interested in my work, they're welcome to go on my website and read about my work. Or
Actually,
contact me.
it's our primary mandate to make the world a better place.
I hope so.
Yeah, you've certainly done a remarkable job. You're an amazing man, I have to tell you. Thank you so much. I love your hat. I really do.
Thank you very much. Now you have to come to Ethiopia and see
You
us.
got a deal. Thank you for being with us as well. Be with us again next week when we have another look into the Jewish world. Goodbye from Mosaic.